Hi. So I know so far my research has been pretty vague. I talked about the opioid epidemic, which I want to stick to, and machine learning in healthcare. Um, I want to narrow it down to one population, though, which is the African Americans. And specifically, I want to talk about African Americans and opioid use disorder with relation to machine learning. Um, the reason this is a problem is because approximately 11.5 million Americans abuse opioid prescription drugs, and this accounts for 78.5 billion US dollars annually. So that's why it's important to talk about this and dive deeply into any aspect of it that we can, really. And thanks to the professor, I looked into some research on African Americans and how they might have different metabolic and tolerance responses to opioids in comparison to other populations. There are certain African American populations that are dying from opioid overdoses at higher rates than other ethnic groups, and I found that opioid drug exposure, it's accompanied by genetic changes in the brain, and these genetic factors and alterations might affect the responses to pharmacological therapeutic approaches, which means they might react differently to treatment depending on how their brain's been affected by the drugs, right? So, specifically, my research talked about the presence of this A118G polymorphism. It's in African Americans and it might affect the binding affinity of the mu opioid receptor. These changes might hamper pain perception, it might reduce response to drugs, and it might increase self administration of opioid drugs. Um, the mu opioid receptor, it plays a key role in pain perception and addiction, and it mediates the effects of morphine and heroin. So the A118G polymorphism, it's been associated with susceptibility to heroin, nicotine, and alcohol addiction. And it's also been correlated with poor responses to naltrexone, which is a treatment for alcoholism. Um, So, just with the little bit of information I've given you about the A118G, you can tell it's pretty important to be included in machine learning if it's going to be implemented to use, to predict future overdoses and whatnot in the for the opioid epidemic. Um, so will these algorithms be taught to include and compute these small details that are so important? Will it take into consideration other disparities that the African American community faces, such as lack of insurance or homelessness, or lack of access to medication assisted therapy? Will these variables be used in statistics? I think the real problem within the problem is that many studies are conducted on white people, and African American, that community is just left out of research altogether. Um, and in order for us to manage the misuse of drugs, we've got to include variables that are specific to ethnicity to create a more precise and individualized medication based therapy regimen that's based on several factors itself. Um, so I want to look into the little research that is out there on the African American community that suffers from the opioid use disorder. Um, Information from my first video and this one, the most important thing from my first video was that you need a lot of high quality data in machine learning. Otherwise, the algorithms aren't trained properly. So my point is, what if the integrity of the data is, I don't want to say compromised, but what if it's just incomplete due to very little research? Would it still be a good thing? Specifically to the African American population, I think it needs to be studied further and implemented into the machine learning, their genetic differences, and how it may affect their susceptibility and reaction in general to opioids. Um, I think including information such as this will be more accurate in predicting future overdoses and hopefully managing the opioid epidemic crisis a little better. So, specifically, I want to narrow my research down to the African American community that suffers from opioid use disorder and what the best way of implementing machine learning for that specific community will be. I want to sort of make a guide of everything that should be considered when implementing machine learning.